Nice to meet you, listeners. This short movie intends to provide information for people who are considering receiving treatment for Pectus Excavatum or chest deformity. Our department, the Department of Plastic Surgery at Kagawa University, provides best treatment for chest deformities in Japan. I am the chair and professor of the department, and my name is Tomohisa Nagasao. Kagawa University is located in Kagawa Prefecture. Kagawa Prefecture is located in the northern part of Shikoku and the south-central part of Japan. And Kagawa Prefecture or Takamatsu City is the most populated city in Shikoku Island. Kagawa Prefecture is characterized by beautiful sceneries, including towns, bridges, seasides, and delicious foods. Our department is very famous in Japan for its excellent treatments for chest deformities. Some patients have chest deformities. As shown in the three figures, some patients present concavity at the central part of the chest. This kind of deformity not only compresses the heart and lung and affects the patient's health, but also it affects mental condition of the patients. Therefore, it is necessary to treat these deformities. We tackle with the treatments for chest deformities with experienced skills, teamwork, and zeal. With our state-of-the-art techniques, we provide best results for our patients. In particular, we are very good at treating adult patients with chest deformities. The treatment for chest deformities is quite different between child and adult patients. In general, treating adult patients is very difficult. This is because the chest of the adult patients is very hard and difficult to handle. In contrast, child thorax are easy to handle. Therefore, it requires a much higher skill to treat adult patients compared with the child patients. And we are very good at treating adult patients. To provide best treatments for adult patients, we use state-of-the-art technology. We put CT data of adult patients and produce three-dimensional models in reference to the CT data. To achieve optimal results with adult patients, we need to know what happens with the patient's thorax. In other words, we need to know what happens, how the shape of the thorax changes in response to the forces applied during the operation. And this prediction is very important to achieve optimal results, and we perform this prediction by our original technique, where we perform biomechanical calculation using three-dimensional models. And here we show you one such example. Here I show you another example of simulation. We are predicting what happens with the patient's thorax after some part of the ribs are removed and then the operation is performed and the sternum is elevated. Prior to doing operations, performing this kind of simulation is very important. By taking advantage of the state-of-the-art techniques, we provide the best results for our patients. Right. Another important point in the treatment for chest deformity is that we need to take special care in treating female patients. This is because female patients have breast, and it is not enough only to correct the chest shape, but also optimal shape should be achieved with the breast. In general, female patients with chest deformities have deformities not only with the chest but also with the breast. Therefore, we need to achieve optimal shapes with the breast. We can treat not only the chest shape but also the shape of the breast. This is because we often treat patients who have deformity of the breast. Some female patients who lost their breast due to cancer surgery requires reconstruction, and we can perform operation for such kind of patients. Not only in clinical practices, we lead the world in terms of scientific researches. We have conducted many biomechanical researches and published our papers in world's prestigious journals. Femininity is symbolized by the breast, and masculinity is symbolized by the chest, and we can work on both. Our department can provide best results for all patients with chest deformities. So please visit our department to receive treatment. Thank you.